No, Deputies Colm, Keaveney and John McGuinness sharing 15 minutes.
Thank you.
Keaveney.
Lascan Corla.
10 minutes.
Thank you. Fianna Fáil remains deeply committed to the full implementation of the Vision for Change. And I believe that it is the policy for the future of the service, particularly in the area of mental health. However, I am very concerned that progress on the implementation of the Vision for Change has been slowing down, just when we need most a functioning mental health service at the most critical time in our lives. I deplore the fact that the programme for government, a commitment of an annual ring-fenced €35 million funding for community health services, has been broken in budget 2014, with funding reduced to 20 million. Lascan Corla, media reports the weekend after the budget indicated that just before a press conference to announce the details of the health budget, the Minister for State Mental Health, Kathleen Lynch, complained bitterly and colourfully about being kept in the dark about the budget. The Minister said that the budget would be restored in 2015. And can I ask you here tonight, Minister, can you confirm to us today that €50 million will be provided for in budget 2015 and it would be then ring-fenced? The cut and the deliberate policy of delaying hiring of critically important community health staff until the latter end of the calendar year has had a damaging effect on the health of those people in society who need us most. And the recent annual report from the Mental Health Commission warns us that the progress that has been made over the course of the last number of years in improving mental health services in this country has come to near standstill. In the opinion of the chairperson of the Commission, John Saunders, I quote, "While some services are making progress towards providing a truly modern mental health care service, there are many others who are simply struggling. There are many contributing factors, including resource constraints and an unwilling part on behalf of the Department to provide support. For instance, more than 90% of the approved centres fully comply in this country with insurance, certificates, HACCP, health and safety, while 60% are compliant with regulations that relate to care plans and other staffing matters." Mr Saunders added in last week's report that, I quote, "There is the potential to make more progress, but resource constraints in certain cases and the reluctance to change and make progress has become critically important." Minister, the Vision for Change has been implemented unevenly, inconsistently across the country, and that there is a requirement on your behalf and on behalf of the Department to be more innovative in its actions and how you support, reinforce your support and have a strong corporate governance in the rollout of a national plan of this importance. The emphasis on resources, particularly the constraints on resources, in the context of that €15 million cut in budget of last year, the commitment that was given is quite noteworthy. The Mental Health Commission expressed concerns with respect to the number of specific areas that require provision, which is impinging on the human rights of vulnerable people. In principle, for example, it is accepted that each sector user, each person of the mental health service, is entitled to have an individualised care plan designed for their recovery. Currently, the Commission estimates that only 60% of approved centres implement appropriate individualised care plans, and the extent of the continued usage of seclusion and physical restraint is simply unacceptable. It is worth noting that of the 9 conditions attached to each of those approved centres in 2013, 4 relate to non-compliance with care planning, 2 with seclusion and restraint, 1 regarding a transfer, 1 regarding staffing levels, and 1 regarding unsuitable sleeping accommodation. Minister, the presence of children in adult units remains a scandal, and the Mental Health Commission reported that, I quote, "In relation to younger service users, there is the most unsatisfactory situation where children are being admitted to adult wards." There were last year, Minister, 91 children admitted to adult wards in one calendar year. A teamed report from the Child and Adolescent Mental Health Services of 2013 on this issue of admission of children to adult units was published also last week. That report highlighted how the Vision for Change recommended that mental health inpatient services for children up to the age of 18 had been provided by dedicated adolescent mental health units. However, 91 admissions of children to adult units took place in 2013, with 60% of these children remaining in adult units for periods in excess of 3 days, and some in excess, 21% of them, in excess of 10 days. When all notifications to the Mental Health Commission of child admissions to an adult unit were examined, over half, 64% of them, stated that there were no CAMHS bed available on the date of that child's admission into a mental health service. Yet analysis of the vacancies within CAMHS units showed that there were, in fact, significant vacancies across the various unit locations and administrative supports. And on occasion, we had seen that children who were admitted to adult units were simply admitted because there was no infrastructure for child and adolescent mental health services in the community. There have been criticisms of the Minister and the HSE management led by staff, frontline staff, patient representatives in Roscommon, in Galway, in North County Dublin, indeed recently in Carlow, Kilkenny and South Tipperary. A HSE report released last weekend says that the mental health service in Roscommon and Galway are being run to an outdated 30-year-old model. Minister, I want you to be aware also that when you make parallels with the Keaveney model, that you look at the number of admissions relative to both of those administrative areas. An expert panel has now been appointed by the HSE to conclude that the services in the West will operate under the new national planning guidelines for the future, with the back-to-date plan from the 1984 shelved that was agreed by frontline staff at the time. The expert report into the West mental health services describes an astonishingly large number of hostels, day centres, sheltered workshops, other supportive community structures, which they say has become the focus of all treatment. These services are criticised as inflexible and expensive compared to using teams which treat people at home, which experts recommend and that are dictated in the Vision for Change. Among the staff that I've spoken to, there is a willingness to address the problems and move on to the new model as is provided for in the Vision for Change. But their fear is that the community resources that they currently have simply will not be transferred in conjunction to the move from the traditional system to the system provided for in the Vision for Change. And the local experience of what has occurred since the closure of the state-of-the-art €3.2 million ligature-free unit never opened in St Bridget's, Ballinasloe has confirmed that. We see a situation where the promised community services in some parts of Galway and Roscommon have proven to be largely fictitious, and vulnerable people have been left dependent on a hopelessly inadequate, dilapidated, substandard psychiatric unit attached to the end of an acute unit, where vulnerable people have to admit themselves to an accident emergency unit, which I have argued is a significant no-no, where vulnerable people who need help and support have to go through an A&E acute service to be triaged to a psychiatric unit at the other end of the campus. In June, we also learned that a group of consultant psychiatrists in Carlow, Kilkenny had withdrawn confidence in the clinical management of that service because they believed it was unsafe. 9 doctors wrote to the Minister with responsibility for mental health, expressing, I quote, serious concerns about local services in light of 9 fatalities that tragically took place in that community. And in a letter dated June 2013 to Minister Keaveney, their doctors repeatedly questioned the safety of the governance of the service and felt that they, quote, it was devalued. They were being ignored in their attempts to raise concerns about the health service executive. Minister, as in Galway and in Roscommon, medical professionals who dared speak out found themselves isolated, dismissed, ignored and ultimately ostracised. Those who criticise the Minister are regularly accused of acting in bad faith and wanting to go back to the institutional care model. They are subject to intimidation by their managers and ultimately their argument is dismissed by the Minister. From my experience, engaging with the medical professionals that I found to be deeply committed to securing the best outcomes for patients worried about the state of the services and the lack of resources. The Commission also highlighted the need for the ongoing independent monitoring of the independent implementation body of the Vision for Change. And they have said that since the dissolution of the second independent monitoring group in June 2012, there was no independent monitoring or implementation of any policy that is provided for within that policy. Alongside calling for the Minister to confirm today about the €50 million to be provided in Budget 2015 to be ring-fenced, I'm calling you to re-establish the independent monitoring group of the implementation group of the Vision for Change policy. Thank you. That's concluded.